Let's talk about some eye anatomy. Now in this video I'm going to go over some anatomy of the front part of the eye and some of the microscopic stuff you're going to see, and I'm also going to go over some CT scans and go over the muscles of the eye, the bones of the eye, and read some of this stuff for you. So let's go ahead and get started with the basics, which would be the external exam. Now the first thing you're going to see in an eye exam is the conjunctiva, and the conjunctiva is just a layer of tissue that sits on top of the eye, and it's clear, and it sits right here on the white part of the eye. Now the conjunctiva is not white, it's clear. You're seeing the white of the eye underneath, and the conjunctiva is a layer of tissue that protects the eye and also creates a surface underneath. It actually loops underneath the inside of the eyelid and forms the back of the eyelids here, and explains why if you say have a contact lens that slips down, why it doesn't go behind your eyeball. It gets trapped by the conjunctiva here, and people that get conjunctivitis get a infection of this layer of tissue. Now the conjunctiva actually inserts right here at the limbus where it becomes clear cornea, and that's the front of the eye, of course. And if we take a picture of this, we see here's the limbus, and the conjunctiva is a thin layer of tissue here, and there's actually little blood vessels running through the conjunctiva. And when you get, say, a conjunctivitis, these blood vessels will dilate and get very red, and that's why your eyelid's pink. Now the eyelids are actually formed by, you could really break it down into two layers. There's an anterior lamella, which has the muscles and things like that, and there's a posterior lamella, which is formed by the tarsal plate. This tarsal plate is a layer of tissue that's somewhat tough, and gives the eyelids its shape and things like that. And some of the muscles that open and close the eye insert on this tarsal plate. Inside the tarsal plate are the meibomian glands. I've actually drawn this wrong. The glands actually sit inside of the plate, and they squirt oil through little pores right here at the base of the eyelids into the tear film. And if we take a photo, we can see little pores here right along the edge of the tear of the eyelids, and oil is squirted out these pores into the tears, and this oil is real important to keep the tears from evaporating too quickly. A chalazion can occur if one of those little pores gets clogged up. You can get a backflow of lipid into the gland, and you can get a granulomatous reaction. It's not an infection, but it is something we see quite commonly in ophthalmology. It's one of the bread and butter things that we see. And people will have a hard lump on their eyelid. It's not tender, it's not infected, but they usually won't go away on their own, and we have to actually flip the eyelid over and use a little scalpel to incise and drain these things. Now that's much different than a stye, which is more like a pimple. It's a little small localized infection, which is usually self-limited, typically red and very tender. The two main eyelid muscles you need to know about are the orbicularis, and these are the muscles that are formed in a circular pattern around the eyes and actually close the eye, and it's controlled by cranial nerve 7. So if you have, say, a Bell's palsy where you lose the facial muscles on this side, these patients have a hard time closing their eye, and that can create a lot of exposure problems. The other muscle is the levator palpebrae, which is controlled by cranial nerve 3, and this muscle is actually a ribbon that attaches to the top of the tarsal plate that we saw before, and it pulls the eye open. And if you have a cranial nerve 3 palsy, then these people have a ptotic eyelid, a very low eye. The mnemonic I use to remember what nerve does what is cranial nerve 3 opens the eye, and you can think of that like a 3, like a pillar, and cranial nerve 7 closes the eye, and you can think of that like a fish hook. The lacrimal system controls the tears and the tear drainage. Now the majority of tears are actually produced by accessory glands up in the conge, up in the fornix usually, but a lot of our reflex tearing is produced by the lacrimal gland up here in the corner, which squirts tears into the tear film here. The tears then are drained out of small little punctum down a canalicular system into a sac, and then down a nasolacrimal duct where it drains into the inferior meatus, which is underneath the inferior turbinate. Here's a video just to show you what those punctum look like. They're very small, and you've got two of them, one on the bottom, one on top. And here's a close-up video of one of them. Here's another patient. This one's a little bit more obvious. Now, people have different size punctum. Sometimes they don't have punctum. People who have chronic dry eyes, we can actually put a little plug inside of this thing, and that way their tears don't drain too quickly, and that seems to alleviate a lot of their symptoms. Here's a patient who had the opposite. She came in complaining of tearing, and under exam you can see that she has an eyelash that's actually stuck in the punctum on that side. So we just pulled that out, and her symptoms went away. Here's an axial CT. I wanted to show you this because the tears from the eye drain into the nose, and they drain down the nasolacrimal duct. And if we start up here at the eye and move our way down, this is right here medially, and follow this down, you can actually see a little hole here, and that's the nasolacrimal duct. Just a little circle, and as you go down it drains into the nose, and here it is draining into the nose. And you can imagine if someone has a lot of facial fractures or some type of dysgenesis of the bones, that this could be broken, and that can cause a lot of problems with tearing. If you do have a lid laceration, the most worrisome area really is medially, because you can cut right through the canalicular structures, and this needs to be repaired surgically, where we will actually run a tube through the system and leave that tube there for while everything heals up around it in order to keep this this drainage patent. But let's go on to the globe, because that's what we're going to be talking about for the most part.